Do it, or you know it's good?
I just kidding. All right, control, please. Control. I got it. All right. Hello, I'm Dr. Philip Yu. I'm the founder of the LaserMed 21st Century Pain Institute in Southern California. And today I'm going to tell you a story about what my biggest frustration was in my practice as a doctor of chiropractic, and I think it's the same for all of us. And in a moment, I'm going to share what that is. I just have 3 rules before we start. A, we're going to have fun, right? We're going to have fun. B, so you don't do one of these and doze off. When I ask a question, you're going to answer. Is that good? Yes. Good. Number 3, if you want to get spectacular results with your stem cell therapy, you're going to take action. Can we agree on that? Yes. All right, great. Without further ado, I'm going to show you a video of what I'm going to talk about. Hopefully I can get it working with this. All right. The play button. Here, I'll do it. So if you go down here, there it is. Volume would help. All right. Here we go. Is it on the volume?
It's on.
Anyways, I'll just explain what's going on. We know Bones McCoy, Chekhov passed out. The surgeon says, "Who are you, a dentist?" And he tells him to get lost, put those butcher knives away. He heals him with some type of laser device, all right? And that's the device that I've created to add to the future of stem cell therapy to get spectacular results, all right? All right, great. Who's this guy at the end? Question 1. Yeah, Dr. Oz. So I'm part of his Health Corps Foundation nonprofit, and we support the future of America. My son's a teenager, David, and I know as a teen he's starting to rebel against me. And kids nowadays are addicted to their electronics. So we have a Health Corps Foundation to treat health and wellness to get kids out to video games and back to sports and nutrition. Please support Health Corps, okay? So the title of my talk is how to get those difficult patient cases to respond to your stem cell therapy, especially for those those failed cases that you dread seeing post-injection because they just paid you $6 grand and they didn't get any relief. This is Jean Kwan. She's holding 2 stem cells for a bilateral bone-on-bone knee procedure. Her last name is Kwan. I call her the Kwan, like Jerry Maguire. Jean, I'm going to give you the Kwan. You're going to get your life back. You can walk more now without pain. That was my hope. Guess what? It didn't work. And I was at a surgical center under C-arm guidance, okay? I felt horrible. Did you know that dissatisfied customers and patients will tend 9 to 20 people? So you are losing up to 20 potential patients because that PO'd patient who just spent $6 grand on 1 injection didn't get results. Happy customers only tell 4 to 6. So you're losing 20 times 6,000 knee cases, 120 grand potential lost cases because your injection didn't work. I thought the surgical center was the answer. Interventional radiologist, he's doing the injection there. Then you do that post-dreaded consultation. Is she going to beg for a refund? Do I have to give another free injection or free treatment? And you don't know what to say. I hate going there. But I found a solution through Star Trek. Laser-guided stem cell therapy. After 5 weeks of having both her knees injected with the stem cells, no results. I did some laser. Now she can walk an hour pain-free. Before she could barely get out of the chair. Okay? I'm not going to play that because it's the sound's not as Jean. So now she can walk for an hour without pain after the laser guidance. Okay? This one I do want to play. I know. So William Shatner interviewed me on Star Trek-like procedures. Did you hear about what was doing
Why
lasers?
is so doing? Yeah. Move America forward.
Well, Mr. Shatner, the non-invasive, non-intrusive medical devices once seen in Star Trek have now become a reality. we have developed new techniques and procedures using LED and infrared light technology, class 4 lasers, and pulsed electromagnetic field waves that are having a dramatic impact on those suffering from chronic pain. For the first time in a long time, these people are actually able to go out in the world and enjoy life again, pain-free. And that, Mr. Shatner, is how we are helping to move America forward.
That's really interesting what you had to say to William Shatner. I want to point out before we get involved heavily in this that Dr. Yu is he's a best-selling author, as we will show you. He was the official chiropractor for the 2008 Beijing Games. He was a chiropractor at the CrossFit Games in 2010, 2011, 2013. He was also the backstage chiropractor for the Beyonce tour. He knows all about what went on there. And he is nicknamed the Pain Terminator. It's a pleasure to have you here. This is interesting. You know, I find it fascinating that the tools of your trade, really, of science fiction,
of the Qualcomm tricorder, and he'd just wave it over the patient and it would give him the diagnosis without any invasiveness. And this pretty much does the same thing. For instance, let's take bone-on-bone osteoarthritis of the knee. Arthritis in Latin, itis is inflammation, you know, pain, swelling, heat causing the pain. Well, we can detect with this infrared thermometer, which this aiming laser beam will detect exactly where the arthritis is worst on the bone-on-bone knee arthritis, and will tell us exactly where to treat it. Now, this is only a diagnostic tool. The way we treat that knee is, this is the world's most powerful German diode class 4 laser at 60 watts. And what this does
you
is...
need glasses for this?
Oh yeah, well, you need the...
You reminded me I needed the safety glasses.
Yeah, you look like one of the members of the USS Enterprise.
Okay.
And then what the laser does, it increases blood flow and circulation to the knee because the knee is an avascular structure, which means it has a poor blood supply, which delivers oxygen, nutrients, glucose, so the knee can actually heal itself. And the invisible photonic energy actually stimulates stem cells, and what we feel, and that's where I discovered this new technology to get, maybe you get 80% results with your stem cells. What about those failed cases? Fibromyalgia, diabetic, idiopathic peripheral neuropathy, metabolic syndrome. This will wipe out the next 10-20% of that pain, okay? Here's a challenge to stem cell therapy that this all solves. Getting the cells to the desired target tissue, having the cells stay there, and achieving the repair, all right? There's an in vitro study done on stem cells in the flask. Second law of thermodynamics is what? Entropy energy. Things tend to get in disorder. The stem cells spread in the flask. What if we had the laser at 810, 660 nanometers? What's happening to those stem cells? They're being attracted to that homing signal. What happens 24 hours when you stop the laser therapy? They're still where that laser homing signal was, okay? It's called positive tropism. What happens when you put a plant on a windowsill? What direction do those stems grow? Towards the window, the light. It wants that ATP energy. It's called what? What is that called, that process when plants grow from sunlight? Photosynthesis. What's that process called when vitamin D3 is stimulated in your bones from sunlight? Photobiomodulation, all right? And that's what happens in your body. I do want to play this to see how lasers do work for photobiomodulation.
Laser therapy uses a process called photobiomodulation to change the condition of damaged tissue by stimulating cellular metabolism, thereby accelerating the healing process. A large convex treatment head can be used to compress superficial tissues, displacing excess fluid and enhancing laser penetration to deep structures. As light pours into the tissue...
Anyways, we don't have time, but it shows how it stimulates cytochrome C oxidase at the cellular level in the mitochondria, which is a powerhouse of your stem cells, and they're not going to grow and proliferate mitosis DNA expression without the ATP energy. Laser accelerates that. Study done on a group of rats, After the laser and osteoarthritis of the knees, chondrocytes started to proliferate. 810, 650 nanometers help post-derived stem cells regenerate in vivo. Again, another study, 660 to 810. Our dual wavelength laser hits both wavelengths, okay? So again, the stem cells the laser helps it adhere to the target tissue, let's say the medial knee, repair and grow. Arnold Schwarzenegger's friend Sandy came in. Again, she did the C-arm injection, didn't work. 6 weeks later, laser guidance, boom, she's back to training. Now she speaks at her seminar. She's her best advocate. She might get Arnold in, all right? Bernice, 91 years old, peripheral neuropathy of the feet, bone-on-bone knees. We didn't think it would work. Boom. Now she's the biggest fan of umbilical cord stem cell therapy. I'm going to offer my best-selling book for anyone who gets one of our laser scanners. They're about $1,200 at the seminar. I have 35 here. You get 20% off. The scans are $997. Dr. Dunn, did you pass out the forms? Good. Come to our booth if you want to see it. You get my other book. I gave you to Dr. Oz, Transform Your Practice, How to 10x Your Practice. Okay? Again, this is the future of medicine, and it's a perfect complement to get spectacular stem cell results. We have medical doctors coming to get our procedures. We use Graston-type laser edge tools to create inflammation in target tissue to make sure those stem cells adhere. This is plantar fasciitis. We use the stem cells to adhere with the laser guidance system. Again, the first 35 who get a guidance system, you will get my best-selling book that Mark Victor Hansen had plugged for me. So again, another thing I'm going to tell you how to fill your seminars when you're talking about lasers and stem cells. This was my best seminar. 133 people came to my desert seminar. 33 appointments for the procedure. So if you want to transform your practice and join the Star Trek The Future of Medicine, go see our laser med staff. And welcome to the USS Enterprise sick bay. Thank you for watching. We're over here.